Anesthesia is a procedure used to eliminate pain and sensation ahead of surgery. That's our focus today on Sound Health. I'm Olasumbo Modupe. Welcome to the show. Can anesthesia be used for other purposes? I read somewhere you can use the procedure as therapy for treating depression. How true is this?
To manage depression with anesthesia, it might be a misnomer. When something is a misnomer, that means it's an aberration, it's abnormal. Because anesthesia, when you look at the definition, is an artificial way of making somebody unconscious or of deadening a particular part of the body in an attempt to avoid pain. That is the lamest way I can define it, which is reversible. You understand? So it's a reversible, artificial way of making somebody unconscious or deadening a particular part of the body in an attempt to alleviate pain. So when you now say management of depression, depression in its own is a psychiatric issue. It's a different entity, and we have specialists that are trained to manage such. So using anesthesia to manage depression might be an aberration or a misnomer.
Okay, talking about other areas of specialization, what is the relationship between anesthesia and other field of medicine?
Yes, that's a very, very good question. People, the time past, or let me say this part of the world. When I say this part of the world, I'm talking about resource-poor countries, developing countries like ours. They've seen anesthesia, or let me say anesthetists, as sleepwalker. That's a doctor that just come in and put me to sleep. But I want to use this forum to enlighten our masses, to let them know that the role of anesthetists in every hospital setting and in medical care can never be overemphasized. Yes, we're service providers to a lot of units. One, to the surgeons, you need anesthetists to carry out your surgery daily. Two, in the polytraumatized, when we say polytraumatized, that is multiple injured patients, like road traffic accident victims, patients that have suffered stroke, let me say critically ill patients. The anesthetist manages these patients. That's in the intensive care units and in the high dependency units. Then to extend, we offer other services. Patients are being referred for advanced care, like MRI, CT scan, and you're talking about minor patients, talking of pediatrics, that is children that cannot actually maybe be steady in this forum, in this area. So anesthesia has extended its service provision to those areas to ensure that these minors are well positioned and they are sedated or anesthetized to actually be able to carry out the MRI procedure or the CT scan procedure. Notwithstanding, I've mentioned 3 units now: surgeons, intensive care. I've mentioned laboratory, that's diagnostic, that is X-ray, radiological, emergency, ER, emergency room. Patient come in unconscious, and this patient require airway management so that they don't aspirate their salivas, they don't choke on their salivas. The anesthetist is sent a consult as well to come and review and then we take care of such patients. The burns patients, when we have burns victims, we manage. Then when we have disasters, talking about natural disasters affecting a lot of people, plane crash victims, fire incidents, in any hospital setting, the anesthetist is always at the forefront because this is going to require resuscitation sometimes. So when we talk about resuscitation, we call it cardiopulmonary resuscitation, CPR. The usual way people know it's about this kiss of life, mouth to mouth. The anesthetist is at the forefront. Yes. Then lastly, when you're talking about invasive line, the common IV lines, drips that me and you know of, or that, let me say, the masses know of, is the usual one that we normally see in the hospital where they hang. But when it gets to the intensive care and in some hematology lab, there are times we're being sent consult to come and put these invasive lines. And these invasive lines require special technique. That is another way to go. Then we also, to crown this, we do chronic pain management. Remember I told you that people have come with low back pain, so anesthetics run a pain clinic, low back pain clinic, and then general pain management clinic. So we're so much into a lot. At times where people call us, oh, we are jack of all trades, but we are master of all. I must tell you, yes. A hospital setting, to crown this, is determined. How the hospital is developed by the level of anesthetic care the hospital renders. Let me just put it like that.
The per capita anesthetist manpower in Nigeria is extremely low compared to advanced countries. What's your take on this?
It's a field in evolution. The awareness is just like getting to so many. Like I said before, that when a patient is being prepared for surgery, the patient only recognizes most times the surgeon because we are just service provider. They come to the theater, we assist them, they go back to the ward. So they actually don't see us like that. But I must tell you clearly that the level of development of any country actually depends on the level of the anesthetic care in that country. That is why I'm telling you now that we anesthetists were still the few to the ratio of the population of Nigerians. Even the general doctors, you can imagine that the ratio is about 1 to 20,000. That is 1 doctor to 20,000 patient. Then you now look at specialist area like anesthesia. You can imagine how, the post style of anesthetists is in Nigeria. So to buttress that point, we're very few. But right now, a lot of people are getting to at least know about the field, and then we're having more anesthetists in training as it is right now. We're having more and more of them in training.
The use of anesthesia dates back to the 60s or early 50s.
Oh.
Are there any advancements in the procedure?
Yes, there's a lot of advancements. Let me correct what you just said. Anesthesia has ever been, is never in the 60s. Okay. Yes, anesthesia has ever been. And the first anesthesia was delivered by Norton. I think William Norton, as dated back to in the 1920s, whereby he used ether to anesthetize for a dental procedure. Subsequently, John Snow delivered the Queen Victoria, that is of a baby, by using propofol. So anesthesia had been a long time. Even before then, there had been series of anesthetic procedure carried out, but there were no records. But in evolution, development had come, whereby we now have state-of-the-art gadgets to monitor patients when they are asleep or when we're doing procedures. You understand? Because anesthesia does not only involve giving the anesthesia, but it requires proper monitoring. That's of the patients when they are asleep or when they are awake. So there are a lot of technological advancements and development in these regards. So drugs involvement, we've had that, and we have newer set of drugs that could deliver what we call very smooth anesthesia. And then we have state-of-the-art gadgets to monitor these patients, whereby you can monitor the monitor itself. You understand what I'm saying now? Like the monitor in the theater is being monitored beat to beat every minute, and with one glance at your monitor, you can actually say what is going on with the patient at that point in time. So it's evolving, and like I said, you measure the development of any country by the level of anesthetic care. Thank you.
Okay, before we go, what are your final thoughts on this field of medicine?
Yes. To our viewers, one of the take-home in this interview is actually to let them realize that anywhere they find themselves facing the need for surgery as an intervention to proper health care, or as a procedure for diagnosis, they have the right to actually request for anesthetists. And the type of anesthesia care that will be given to them during the surgical, they have the right to know about it and to know the anesthetist it's going to be. So that is one take home to our viewers. Then to the profession itself, I want to use this medium to encourage our doctors in the private practice as a whole, because in most of the government centers, we have anesthetists domicile, yes, on standby. But when we're talking about the private practice, a lot of doctors tend to want to maximize profit at times, and they want to decide for the patient when it comes to anesthesia, which is not ideal. So I must plead with them using this forum to let them know that when an anesthetist is considered for particular procedures, the success is better. The risk of maybe complication and even mortality, that we call death, is very, very minimal, with the specialist doing his own on one end and the surgeon having a very calm and relaxed atmosphere to perform his surgery. Yes, so in the field of medicine, I will implore medical doctors generally to actually take this field of anesthesia as very, very sensitive, very important to the success of every surgical procedure.
Thank you so much, Doctor, for sharing your thought with us on Sound Health.
Thanks for having me. It's my pleasure.
Okay, that was Dr. Olajide Ayeni, a consultant anesthetist, on the role of anesthesia in the field of medicine. Sound Health continues with trending and home essentials. Please stay with us. The program continues.
3D visualization and augmented reality for surgery.
Surgeons have relied on microscope oculars or other camera systems to operate. However, surgeons also typically depend on their own eyes and interpretations to execute the most precise tasks. Two of the most intricate surgical practices, neurosurgery and retinal microsurgery, have been experimenting with new technology in the past year. These stereoscopic systems not only keep a surgeon's head up, but it immerses the surgeon into a high-resolution 3D visual representation of their subject. Experts and surgeons that have piloted the new systems believe the added comfort and visual information will allow surgeries to operate more efficiently and effectively. A growing number of hospitals will be adopting these new systems in 2017, pushing the boundaries of surgical reality as we know it.
This is where we say thank you on today's edition. Hope you've learned a few things. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #Soundhealth. A sound health is a sound mind. Make healthy living your choice.